This is the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. The vulva is one of the most misunderstood pieces of sexual anatomy. For example, a lot of folks use the terms vulva and vagina interchangeably, despite the fact that these are actually two distinct things. A lot of these misunderstandings stem from the fact that sex education remains poor, leaving many people with an incomplete understanding of their own bodies. So in today's show, we're going to talk about what you don't know about the vulva. Some of the topics we'll discuss include the lifespan of the vulva and how it evolves over time, the importance of maintaining a healthy vulva, and how medical education is failing all of us, including our doctors, when it comes to understanding the vulva. My guest today is Dr. Maria Ulloco, a board-certified urologist specializing in comprehensive sexual health, reconstruction, and prosthesis. A former clinical professor at the University of California, San Diego, Dr. Ulloco is now the CEO of MUMD Sexual Medicine Consulting and the founder of Vulva AI, an innovative patient advocacy tool that employs AI to aid patients grappling with vulvovaginal issues. This is going to be another fascinating and very practical conversation. Stick around and we're going to jump in right after the break. Are you curious about sex and psychology in other countries? Join me in Sexual Health Alliance as we expand your knowledge through their study abroad programs. Let's explore different cultures, engage in immersive learning experiences, and collaborate with international experts while traveling to amazing places and having fun with students from all around the world. Since 2015, Sexual Health Alliance has remained at the forefront of sexuality education. So join me, Shah, and a global community of students for a transformative study abroad adventure. There are 4 study abroad options throughout 2025. Check them out at sexualhealthalliance.com. Come meet fantastic people and be at the leading edge of sexual health education with Sexual Health Alliance. Spots for 2025 are available now, so visit sexualhealthalliance.com to secure yours today and embark on an exciting global adventure to study sex and psychology with me. Hi, Maria, and welcome to the Sex and Psychology Podcast.
Thank you so much for having me. I'm so excited to be here.
It's a pleasure to have you here. So you're a urologist who works in the area of sexual medicine, and you do a lot of education around sexual health. So I wanted to start by asking, what inspired you to get into this field in the first place? Where did your passion for sexual health come from?
I was always that kid that they say, don't touch that thing, I would need to go and touch that thing. So my parents were very anti-sex, very patriarchal, very deeply Christian. And so if you're going to tell me not to do something, I'm going to get very curious as to why not to do it. And so I think because they just put it in my zeitgeist and it was the thing I'm not supposed to do, I just got really deeply curious about it while also being very deeply sheltered. So I went to a Christian school up until 7th grade. And so I was a really slow learner, a really late bloomer, but also just always found this fascinating. And I think it was also a little bit of rebellious of, this is my ability to rebel against the patriarchy and all the things, because I have 3 brothers and we were treated very differently growing up. And so this learning about sex and sexual health was kind of my ability to rebel against a system that wasn't very fair to me. And so I loved learning more about sexual health and learning all of these secrets, but they weren't really that secretive. They're just a normal body function.
And, we would all do so much better if we knew all of those secrets, right? And I think this is a big problem is that sex is something that is shrouded in secrecy, often from a very young age. And then people get to adulthood and they're having sexual relationships and they don't know fundamental, very basic things about their own body, let alone their partner's body, and contributes to a lot of sexual problems and difficulties. And so it's really important to have people who are doing work like you're doing, helping to normalize these conversations about sex, and also to teach people what they really need to know about it, to unshroud sex from its veil of secrecy, if you will.
Yeah. Sex is what literally keeps our population alive. And yet it's the thing that we don't talk about. It's just like, it's the weirdest dichotomy if you really step back and think about it. It's just something that you're supposed to inherently know and do, and it's your birthright. But shh, oh my God, could you imagine? Like, no, it's like, guys, we're all going to do it at some point, maybe. For the most part, by statistics, let's at least learn about what we're doing and why we do it and how to do it safely and pleasurably.
Yep. Totally agree with that. So we're going to be talking all about the vulva today. And I always like to start with definitions so that everyone is on the same page. Now, the term vulva is often used interchangeably with vagina. Like you hear this all the time in media and popular media, in casual conversation. People just kind of use these terms as synonyms for one another, which is actually incorrect. So what is the vulva anyway?
Yeah, so the vulva is all the external genitalia. It's an interesting term because it contains like 9 to 10 different parts, but we call it the vulva, and most people call it the vagina. And I think that it's actually such a beautiful narrative around kind of the lack of scientific accuracy in women's health. Because I take care of all genders, all genitalia, it would be wild if I said, oh, this patient's penis doesn't work when I was actually pointing to their scrotum. It's a very fascinating dichotomy between genitalia, how one is so specific and the other one's just like, I don't know, that's just the vulva. So the vulva includes the clitoris, your labia majora, your labia minora. It includes the urethra, which is the hole that you pee out of, the vulvar vestibule, which is my favorite tissue structure. It includes the vaginal introitus, or the opening of the vagina. It includes your pelvic floor muscles. Yeah, it includes a lot of parts. And most people are thinking, when they're thinking about their vagina, they're actually really thinking about their vulva, because the vagina is actually just the canal on the inside of the body. You don't really see that. And so I think it's so important that people learn first and foremost what to call the tissue structure or the organ. And I think that's just such an important distinction to make.
Yeah, it's so important just to have that basic understanding of anatomy, just so that you can understand your own body. And also so that when you go to a doctor or healthcare provider, you can be more specific about concerns or issues or problems that you might be having. But, as we mentioned, sex ed in general is pretty poor. And education around the vulva specifically is even worse, right? Because many people probably won't even hear the term vulva in their sex ed course. And I think that's why a lot of people are confused about it. But it's a topic that even doctors don't necessarily get much education on. And our doctors are the ones that we entrust to take care of our sexual health. But in the studies that I've seen, the amount of sex ed that doctors actually get is shockingly low, which I think helps to explain why a lot of sexual health issues often go unaddressed in the doctor's office. But when it comes to education about the vulva specifically, how much are doctors really learning about it?
Oh, Justin. I think this speaks to the larger narrative. You don't know what you don't know, right? So when I was going through training, I still remember in anatomy and physiology learning about the vulva. And it's like, these are just kind of parts and they don't really matter. The vagina is what we're going to focus on. The uterus is what we're going to focus on. So just even that, my first entrance into learning about the vulva was so dismissive. It was so like, I don't know, these are just parts, whatever. And then it wasn't until my fellowship, I went through a urology training. Again, we're in the vulva where the urethra sits right there. We're in the vulva, but we didn't learn anything about the parts of the vulva because, again, it didn't matter. At least that's what's the general feeling. The vulva belongs to the gynecologist, not us. We're just the urologists. We just deal with the pee hole and the urine. And fellowship was when, and this is the only fellowship in the country at the time that actually also dealt with vulvar sexual health. That's when I learned that there was so much science behind the vulva, and each part is its own unique ecosystem and needs its own unique things to stay healthy. And like when those things aren't healthy, they become problematic, and it can lead to things like recurrent urinary tract infections. It can lead to things like chronic pelvic pain, recurrent vaginal infections, overactive bladder, conditions that I was seeing as a urologist that didn't really necessarily have really great treatments for it if it didn't fall into the guidelines, which unfortunately a lot of people based off of the guidelines aren't getting treated appropriately. And we don't know that. We just think, oh, wow, this disease is so hard to treat. And then when I did my fellowship and I started learning that each part had its own unique function and how to keep it healthy and what dysfunction can look like, it just made me such a much better doctor. Like, your recurrent UTIs isn't recurrent for most people. For most healthy people, it isn't recurrent. A lot of it can be a vulvovaginal disorder. And if your doctor doesn't know to look for that, you are going to be told you have recurrent disease versus you're actually just being misdiagnosed. And that's a lot of what my research has shown. And one of the things and how I came about this was because I'm a patient advocate. When I started my chronic pain practice and after fellowship, the constant stories I would hear in my first 2 years of practice, I saw over 2,000 patients, which is unreal. And it just speaks to how many people are suffering from these conditions. And although each patient's story is so unique, the theme was so stark. It was just every single person had the same theme of, I went to a doctor, they misdiagnosed me. I went to another doctor, they misdiagnosed me. I went to, like, consistently over years. On average, it takes 7 years to get your first correct diagnosis, and people will see at least 3 doctors. It's not that these patients are difficult or challenging or hard. It's the fact that doctors truly aren't trained. And I felt that, I heard it. And the stats also now support it. You know, only 50% of medical schools even require sexual health training. And if you're going to get it, 80% of that is going to skew towards penile health. And so a lot of people are leaving training just not aware of the vulva. And we actually just recently did a study that we just submitted that showed that of the medical trainees that are currently out there in the world seeing patients, whether that's a gynecologist, urologist, ER physician, primary care, dermatologist, these are areas where people with vulvovaginal issues are going to. 75% of them had never learned how to do a vulvar exam, never learned how to examine it, never learned how to keep it healthy, how it's supposed to work, what dysfunction can look like. They don't know how the disease states, and they don't know how to treat. So I'm a big believer that a lot of what we're calling chronic disease is actually misdiagnosed. A lot of vulvovaginal issues aren't chronic. They're just misdiagnosed. And I'm on a mission to train physicians on the science of the vulva. And like, one of the most heartbreaking things is that so many gynecologists who have been deemed the women's health specialists don't know this information. And they also don't know that they don't know. And so one of my passions is sharing this information widely, because the lack of doctors being trained on this means that it's much harder for patients to find the right care.
Yeah. And I think you make a really compelling case for why we need more sex education in medical school. You know, if it's taking patients 7 years to get a correct diagnosis for a vulvar health issue, like, that's, you know, the amount of excess care that they're receiving that they didn't need, the unnecessary prolonging of suffering and pain and other things like that. Like, there are so many things that we could improve just by having better sex education in medical school. I talk about this a lot on social media, and it's interesting because whenever I post things about, you know, doctors need better sex ed, I always get a little bit of blowback from some people who are like, oh, doctors can just refer you out to a specialist. Like, all doctors don't need to know about sex stuff. Like, they'll just send them to a specialist. And it's like, do you know how few specialists there are, you know, who have this kind of knowledge that's needed? Like, there's some general basic level of sexual health information that all doctors need to know that could really help them to improve and take care of their patients' health in much better ways.
Yes. I mean, it is shocking how little we are taught about this part of the body. And it's so interesting. I've never seen, there's no other part of the body that quite has such cultural significance than the vulva in sex, right? Like, no one's shaming you about elbow anatomy. No one's saying like, oh, you don't need to learn about the heart. It's whatever. 50% of the population has a vulva. Why are we not learning, and why are we not training on this? Like, 100% of the population has a heart. So we should, like, it would be crazy if we all left medical school without learning about the heart, about the lungs. Like, we learn a lot about the penis. I learned a lot about the penis. And I love that I learned a lot about the penis, but it was such a disservice to me as a clinician to not learn about the vulva, because I am a much better doctor, and we are coming up with much more innovative and creative ways to diagnose patients and end their suffering. It's just one of the coolest and most rewarding things to give people back their life. One of my favorite stories that recently just happened was I had a patient reach out to me, gynecologist herself, currently in gynecology residency, gynecologist, which is considered the women's health specialist. They should know about the vulva, was having recurrent UTIs every time she had sex. So pain with sex and recurrent UTIs. And, a lot of people poo-poo these things as like, whatever, but these are conditions that are debilitating to a patient. So she is a busy resident, working hundreds of hours a week, can't have sex with her husband, wants a child, can't do those things, has all the access and has all the resources. She's a gynecologist herself, goes to all of these doctors, is constantly misdiagnosed. She now starts believing that she's never going to get better. She's never going to have a kid. Her life is falling apart. She's also to see these specialists costs money. And so by the time she comes to me, she's so desperate. And she's like, I just know I'm never going to get better. And I was like, and I didn't want to tell her, I was like, honey, you're like the third person I've heard the same story today. You're going to be fine. And she's like, how is it that I'm a gynecologist and I don't know any of this? And I was like, this is the work that I do. And this is why it's so important. And she now sees the value of it. So fast forward, she's like, I'm never going to get better. This is never going to get better. 6 weeks later, she texts me, oh my God, I'm better. And then 3 months later, she texts me, hey, I'm pregnant. It gives me goosebumps, right? It speaks to just a larger narrative. A gynecologist herself didn't know how to treat her own body. She then started believing that she'll never get better. And if you understand the psychology behind chronic disease, if you believe you're never going to get better, it's actually much harder to get better. But because she decided to trust the process and listen and, all the things, she's now going to be a mom, the thing that she wanted her entire life, and also helps her relationship, helps her be a better doctor. And she's no longer having sick days all day, all the time. So when doctors push back against sexual health, I'm like, it's not just sex, because our society is so sex negative that a lot of my research is actually tying the vulva to actual disease states. Instead of thinking about it as a sexual organ, I like to think about it as an organ that can cause diseases. And so people care a lot about UTIs. They don't necessarily care about sex. So when I bring it back to this is why the vulva matters from a urinary standpoint and from a bladder standpoint and from a urology standpoint, people buy in way more than if I were like, this is why it matters from a sexual health standpoint. They're like, I don't care. But when you start tying it into disease, people actually start paying attention. And so that's been a lot of my research around this, because I've also gotten that sentiment of, why should I know this? I don't care.
Yeah. And, it's unfortunate in some ways that we kind of have to take the sex part out of it just to kind of get buy-in so that people will be open to learning about it. But, sometimes you got to do whatever works in this area, because, that story that you shared is really amazing, because it shows how just having this knowledge, equipping doctors with it so they can provide the appropriate care, can give people their lives back, give them a new lease on life. And that is so, so important and so powerful. Now, you recently gave a talk at the Kinsey Institute on the lifespan of the vulva, which I think is really interesting and important. So walk us through some of the main ways that the vulva evolves over the lifespan.
Yeah, so I like to think about the vulva as a garden. And it's such a terrible analogy, but bear with me. So the vulva is such a fascinating structure. It is so hormonally sensitive. And, when you're born, your vulva looks like a little kid. It kind of grows with you, but doesn't really look like the adult vulva. That maturation or the progression of changes actually starts in puberty. So in puberty, your ovaries start secreting large amounts of hormones, which actually changes your vulva. Your vulva literally starts to grow, and then you start seeing that adult version of genitalia. And then when your hormones start to decrease or decline around perimenopause and then fully stop in menopause, your vulva literally starts to change. It starts to shrink. The skin gets red, raw, and inflamed. The skin starts thinning. The pH changes, which changes the good bacteria. So now you have more bad bacteria. This is the direct cause as to why so many women and people with vulvas, as they reach older age, have UTIs. This is direct cause why they have pain with sex, vaginal dryness. All of these issues are directly related to the hormonal status of the person. And again, because there's this cognitive dissonance, we're like, that's so crazy that older people get all those things. Well, and then they just keep moving forward. I'm like, no, guys, there's a reason this is happening. And the reason why I actually use the analogy of the garden is that we know that in order to keep our garden healthy, we need hormones. So, and the hormones that we need are estrogen and testosterone. Everyone constantly forgets that testosterone is an every person hormone, and research has actually shown that the vulva is really testosterone sensitive, and it's predominantly dictated by testosterone. Without those hormones, these changes happen. The thing is, like a garden, if you just give it water, sunlight, nutrients, you can actually keep your garden healthy. So one of the things that we have allowed in healthcare is the changes, those vulvovaginal changes that we talked about. All of those changes are actually preventable. I am a big believer, I'll say it with my full chest, you can have the same vulva at 20, at 100 years old. There is no reason that we allow these changes to happen other than medical neglect, because there are medications that are low-dose vaginal hormones that have been shown to be safe and effective and reverse or prevent these changes from happening. One of my favorite stories of this and understanding this is, again, as a urologist, this is, again, where the cognitive dissonance and training happens. As a urologist, we know that recurrent UTIs are a very common problem for us, and they're a very common problem for our patients, and we hate seeing them. But in our guidelines, we are not really necessarily pushing vaginal hormones, because even though we should be. And so oftentimes urologists will be seeing these little old ladies with recurring UTIs. We see all these changes that have happened, and then we're like, oh, well, here's some more antibiotics. So how I even brought these two together was I had this amazing abuelita, one of my first patients as I was my first big girl job. And she came to me, and I was like a vulvar vaginal, sexual health clinic. And she's like, I'm so desperate. I know this is a clinic for sex. And I was like, well, I mean, it's for anyone, but I need help. I've been getting UTIs every week. I'm in the urgent care. I am miserable. And like, her daughters were amazing and so supportive and always come with her. And they're like, doctor, please, like, just do something. Like, she needs help. And I was like, okay, let's try it. And I created this protocol actually based off of my work with her. And so I did an evaluation as the standard AUA guidelines say, but I noticed during my evaluation, I was like, oh my God, your vulva is literally so shrunken and swollen and red and raw and inflamed. This is why you're having the symptoms. And this is why your cultures are constantly positive. We treated her vulva. We stopped her symptoms. Like, she never got a UTI again. Like, this was a woman that was suffering for 20 years. And all it took was a vulvar specialist and also a urologist. But I did my urology workup. But if I was still just a urologist, I would have stopped there. I'd been like, well, don't know what's wrong with you. Here's some more antibiotics. But because I'm a vulvar specialist, I could also incorporate all that knowledge in my workup. And I gave this woman her life back. And like, I still remember the first visit where she is in 6 months since her last UTI. And we just were all crying, daughters, abuelita, me. And I was like, this is amazing. And this is why, again, like I say, doctors need this care, because I love seeing these patients. So many doctors don't enjoy it. And the only reason they don't enjoy it is because they're not helping them. And it feels really demoralizing when you see someone suffering and you don't have nothing left in your toolbox. And because I have such a rich toolbox, because of my sexual health knowledge, I'm able to help these people and give them their life back. And I want to give that to not only patients, but I want to give that freedom to doctors too, because, it is the best feeling in the world.
Thanks for sharing that. And, since you brought up the topic of menopause, the average age of menopause in the US is 51, but it can start as early as your late 30s. And so what this means is that, there are a lot of women who spend a lot of their lives with an absence of sex hormones in their body. Mm-hmm. And, what you're talking about with regard to hormone supplementation is something that may be very important, considering you're spending so many years of your life without your body producing those hormones that help to maintain the vulvar tissue. So with regard to hormones, just a couple of questions about them, because I think there are a lot of myths and a lot of misinformation about hormones, right? Many people are kind of scared of them because of some research in the early 2000s that linked it to elevated breast cancer risk. And in recent years, there's been more of a switch toward local hormones, which are applied topically, as opposed to systemic hormones, which go throughout the whole body. So tell us a little bit about how hormones work in treating menopausal symptoms and how safe they are.
Yeah, so I love this question. And I start this question by framing it in a binary, because unfortunately, medicine is in a sex binary. And so I'm going to explain that, as a urologist, we're really comfortable with HRT because we've been giving HRT to men as part of our training. When men get low testosterone, it is their given right. We love quality of life. We want them to feel good. That is how I trained. And I love that mentality. Like, I love quality of life decisions and conversations. I love life-saving conversations, but the conversations around quality of life were just so much more fun. Of like, okay, cool. We treated your prostate cancer. We got you life back. But now that you're alive, let's make sure that your life is worth living. And I loved those conversations. And that's why I went into sexual health. And then I get to women's health and I was like, okay, cool. Like, quality of life, amazing. And then there's like fear. It's just constant fear mongering. Feelings over facts is what I call it. And so a lot of people feel that hormones are dangerous because of the WHI study, but the facts are completely showed the complete opposite. And unfortunately, because there's kind of this permissiveness around, there's a kind of general acceptance that women's health doesn't necessarily factor in quality of life. That misinformation is even felt and perpetuated by doctors. So many doctors have not stayed up to date on the most recent research around women's health. And so because of that, they are still espousing essentially facts that have been debunked. So that is what I'm saying. And then hormone replacement therapy isn't for everyone, but everyone should at least have the option to discuss it with their doctor. Mm-hmm. So HRT, what does that mean? Your ovaries make a lot of your sex hormones. At some point, that production is going to decline or stop completely. So for testosterone, you'll have a significant decline, but it doesn't necessarily fully stop. But estrogen, however, fully stops. So there are two types of HRT that can help alleviate some of the symptoms that happen when your hormones fully decline. So there are systemic HRT, which is what's going to raise your blood levels. That's really great for the classic symptoms of hot flashes, night sweats, mood changes, weight gain, anxiety, hair loss, all of the big menopause symptoms, which there's so many, and we're constantly learning more and more. That's what's going to help manage those. Then oftentimes, the systemic hormones aren't high enough to coat your vulvar tissue. You still will need local hormones. So local hormones are hormones that you place directly to the genitals that just work to water the garden. That's what I call it. So another, back to the anti-garden analogy, those hormones only work just locally. So they're much lower concentrations and they're just meant to water the garden. When you water your garden, you don't flood your house, right? And I use that analogy because so many women and so many people with vulvas are so scared of hormones because of the fear mongering from society, from their healthcare professionals, and then just like a lot of the misinformation on the internet. So when I'm telling them that, hey, the treatment plan includes hormones, local hormones for your recurrent UTIs or we always have this conversation of, I don't want to be on that. I'm like, okay, why? And it's always the same misinformation. I heard they're dangerous, and rightfully so. And so we have to do a lot of education. And I use that analogy often of like, hey, these hormones are just local. We're just watering your garden. We're just keeping your garden healthy. That local hormone, you don't have to be on systemic hormones to be on local hormones. And like, some people just want their vulvovaginal health addressed and they just get on the local hormones. Some people want their all of their symptoms addressed, not just their vulvovaginal. And so they'll do the systemic and the local. Again, I want to inform people that are going to experience menopause that they have choice, they have agency. No matter what, if my personal opinion, I think if you want to prevent diseases like recurrent UTIs, pain, decrease vaginal dryness and itching and all these things, every single person should be on low-dose vaginal hormones for prevention. Systemic hormones are a little bit more of an option. It's a little bit more of a lifestyle and health choice. But I really do think that every single person with a vulva needs to at least be informed of the changes that are going to potentially happen to their body and ways to prevent those changes. Because it's not just like, oh, you can't have sex. It's like, no, you could die from a UTI because you're now having UTIs. And so these are really, really important conversations. And the important conversations first start with education and destigmatizing things that shouldn't have never been stigmatized in the first place.
Yeah. And it's, as you said, about so much more than just sex when you're talking about UTIs and pain and inflammation and all these other sorts of things. And, I think you make a really important point about how we need to inform and educate the doctors who need to be aware of the latest research that's out there so that they can counsel their patients most effectively. But there are also a lot of myths and misinformation out there in the general public that we need to correct as well. And so, for every individual patient, it's going to require a custom solution, but you have to start first by giving people the proper education so that they can make the healthcare decisions that are right for them. So you recently created a new tool called Vulva AI, which uses AI technology to enhance our understanding of the vulva and to improve health. So tell us a little bit about this tool and how it works.
Yeah. So this tool, I say, is a love letter to my patients. Being a patient advocate and getting to sit with a lot of them and hearing a lot of the medical trauma that they faced and seeing how they internalized it made me realize that there is such a huge gap in education and training, and even in my own personal experience, I was like, wait a second, I didn't learn any of this. So I just thought it was me, not just thought it was me, but I was like, it's probably not that important. But then I started seeing how that lack of training was directly impacting patients. And the more and more stories that I heard, the more I became really like, what the fuck? There's something about a statistic, there have been stats already showing that doctors are really bad at sexual health, especially for women. There are stats that show that doctors are not good at pelvic exams, are not good at all of these things, figure after figure, stat, paper after paper. And yet there hasn't been actual clinical change. I digress. But so there's a difference when you read that study and you're like, oh, that's crazy, versus when you're hearing these stories. Like the stories were just so impactful. And then those stories actually made me go to the research and the literature and the history and understand what's going on. And then once I went to the literature and the history and all the things, I was like, oh, wow, we have a mass shortage of doctors that are being trained on this. And so I have always been a problem solver. And one of the things I haven't historically loved about healthcare is that there's kind of this general like, well, that's just the way it is. And I'm like, we made this system. The system is made up. Like we can change that. And there's a lot of, let's just lay down and die. Like, that's just how it is. And I'm like, you guys told us that we were some of the smartest people. We had to jump through all these hoops, that we had to pay a ton of money to learn all this training. And I left that without even getting my money's worth. Like I can't even diagnose myself. Like what is happening? And then to now be in this space and then to constantly hear, well, that's just how it is. It just didn't really sit well with me. And I have a lot of friends that are in tech, and I got to see, well, I have dated a lot of men in tech, and I got to hear their problems that they were solving. And I was like, I could do that. Like, I was like, I want to do that. I want to solve large scale problems using technology. And I was like, this is a perfect large scale problem, and especially using AI. So AI for me is a great way to fill in the gaps where humans are failing. And currently humans are really failing when it comes to vulvovaginal care. The problem is, how do you cause widespread training? How do you do that? First is awareness. Physicians first need to know that they are not being trained on this. Great. Now that you've made them aware, how do you then train them? And it's not like they're going to all go to a conference or go back to school. That's just not realistic. And so I realized that in order to do widespread training, we need AI solutions and technological solutions. And so I've built several iterations of this for patients and for physicians. It's like, I want to free us all. I want to free the patients from the awful cycle of suffering that they don't necessarily need to. And a lot of that comes from, a lot of these patients are super motivated. They want to learn. They want the resources. They want the information. They're going to Reddit. They're going to Facebook to find medical care. That's unacceptable. And so I wanted to build something for them to get all of this really high yield, easily digestible information about their bodies and how to diagnose themselves, how to get to the right care, how to get to the right physician, how to advocate for themselves in the doctor's office. And then I also wanted to provide resources and tools for physicians so that they also are supported. Like, how do I diagnose this patient? What are the labs that I need? What are the imaging studies that I need? How do I clinically support the physician and the clinician in real time? And so that is what Vulva AI is doing. We are using predictive AI as a clinical decision maker for doctors and clinicians. And then on our consumer facing side, we're using this as an educational platform for patients and for people suffering from chronic vulvovaginal conditions. Again, because I don't believe they're chronic. I just think they're misdiagnosed and they need access and resources to how to advocate for themselves, because this is a silent epidemic. If you start listening to these patients, you can't unhear their stories, but so many people refuse to listen. And so I actually love empowering my patients to understand that they are their own biggest healthcare advocate. And how do you advocate for yourself? It's by arming yourself with education. And so I wanted to be able to provide solutions on all fronts to be able to move forward and get people the care that they need and get doctors the training that they need on a wide scale level.
Well, I love that. And I love that you're very invested in creating solutions and challenging and changing the status quo, because we really need to work on that if we really want to improve healthcare for all. So thank you so much, Maria, for helping us to better understand the vulva. I'm really looking forward to diving into a specific feature of the vulva, the clitoris, in the next episode. Can you please tell my listeners where they can go to learn more about you and your work?
So you can go to marialocomd.com to stay up to date on all the things that we are doing, podcasts, articles, book with me. I have a clinic in Beverly Hills in LA, if you're in LA. And I have educational consultations for anyone outside of California that wants to figure out how to get diagnosed, how to get treated, because a lot of the conditions that we're calling chronic, again, are not chronic. Your doctor just doesn't know. You can also follow me on Instagram, Maria Uloco MD. Love to drop educational, fun little nuggets. I'm also on TikTok as SexMedEd. I'm really bad at TikTok. Keep forgetting that I have it. I'm also on Twitter at Maria Uloco. And also follow and subscribe and join the waiting list for Vulva AI. The more followers and subscribers that we have makes it so that this dream becomes a reality.
Well, thank you for the work that you do, and I will be sure to include links to all of that in the show notes. Thank you again so much for your time. It was a pleasure to have you here.
Thank you so much.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. You can also follow me on the socials for daily sex research updates. I'm on Twitter and TikTok at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. And if you have a question you'd like me to answer on a future episode of this show, you can leave me a podcast voicemail at speakpipe.com/sexandpsychology. Thanks again for listening. Until next time.